A library can feel like a refuge for anyone, especially a teen. Now a rising sophomore, 15-year-old Angel Marin Caceres still remembers her librarian at Cameron Middle School in Framingham.
She would notice that you're like feeling down, and also just ask you a question, if are you okay? Do you need anything? And like she would just listen to your problems.
Now that librarian, Elizabeth Thompson, is prepared to do more than just let her students catalog their troubles.
Kids come to the library, and it's kind of a unique third space.
She's recently completed specialized training like this, offered in the wake of the pandemic to teach librarians how to help teens having mental health problems. It's not just for school librarians. Statewide, libraries anticipate a rise in need and used COVID relief from the Institute for Museums and Libraries to fund the effort. Librarian Thompson sees this type of training as overdue.
I would have taken it before COVID because I saw the need then, but I think even in the fall, the impact is still going to be there, and kids are still going to be struggling, and there will still be anxiety, and there will still be depression, and there will still be just the usual adolescent stuff. It's hard enough. So.
Experts on children's mental health say a crisis has been brewing in the isolation of the pandemic, and that very isolation cut off children from an important resource.
Children really get the vast majority of their mental health treatment in schools. And so with the pandemic and the shutdown, that access to behavioral health services was gone. And the more we can let adults, trusted adults, see those as signs of people looking for help, the better we'll be able to respond and support these kids.
Sitting with a person and really hearing them out and hearing what they're going through might be what a person needs.
Massachusetts Training for Librarians is run by the nonprofit Walker Therapeutic and Educational Programs.
We tend to have a sense of how we would support someone who's having a medical emergency, but we don't draw the same parallel to someone having a mental health issue or mental health crisis. People are worried they're going to get it wrong, so they tend to not say anything.
When teens aren't burrowed in their books or behind their computers, they often share what's bothering them, say librarians. So it helps to know how to help.
When you are a safe space and students share things with you, what do you do with that? Where do you go to? What are the things that you should or should not say? And it was super, super helpful.
On the surface, school may look like back to normal in the fall, but with training, librarians may now better read the need for help. Liz Neesloss, GBH News.